This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
The Colorado State EMS Annual Conference 2024 is coming up, and if you're in the EMS world, this is an event you can't afford to miss. Whether you're in pre-hospital medicine, emergency medicine, or involved in emergency services in any capacity, the conference offers something for everyone. You'll find cutting-edge workshops, expert-led sessions, and hands-on training that will cover the latest advancements in emergency medicine. And here's the exciting part. We'll be there too. Emergency Medical Minute is setting up a booth where we'll be sharing our mission of providing concise, evidence-based education to the EMS community. So if you're looking to sharpen your skills, connect with like-minded professionals, and stay on the forefront of EMS knowledge, mark your calendars for the Colorado State EMS Annual Conference 2024 happening from November 7th to 10th in Keystone, Colorado. We look forward to seeing you there.
Hey guys, Dr. Lynch here. Today I want to talk about neutropenic fever. So this is a very specific type of fever that we see in cancer patients. As we all know, cancer patients undergo chemotherapy, and chemotherapy is great at killing off the cancer cells, but it's also very nonspecific and ends up killing off our own immune cells, specifically our neutrophils and our monocytes as well, as an unintended byproduct of the drug. And when this happens, patients become very susceptible to infections and then often present to RED subsequently. This process usually takes about 7 to 10 days after the last dose of chemotherapy for the patient to truly reach their nadir of neutrophils. And just to kind of couple general things, so patients can generally look completely fine, but be quite sick because they have no functioning immune system. And it's important to know what type of malignancy they have. So in general, the hematologic malignancies, they have more intensive chemotherapy and they're a higher risk patient for developing neutropenic fevers, whereas solid tumor malignancies have less intensive chemotherapy and that are a lower risk. So what is the true definition of neutropenia? They have to have one recorded temperature greater than 38.3 degrees in the ER, or they have to be over 38 degrees for 1 hour. That comes out to about 100.4. And then a little bit of background. So why do we truly care about the neutrophils? So neutrophils are the most abundant type of white blood cells we have in our entire body. They make up something like 50 to 70% of all of our white blood cells. And they're the first immune cell to arrive at the site of an infection or an injury. And they quickly respond to signals from the body indicating that there's an infection. And oftentimes, when we look at a CBC in any patient, really, we look not only at the white blood cell count, but we also look at the neutrophil count because that gives us an idea of whether or not this is an acute infection or not, whereas the white blood cell count is a very kind of non-specific marker. So when you look at a CBC, it's broken down into neutrophil percentage as well as the absolute neutrophil count. And that's the value that we care about in neutropenic fever. So when you look at the absolute neutrophil count, anything less than 1,500 is considered mild. Anything less than 1,000 is considered moderate, and that's our cutoff for neutropenia in the ED. And anything less than 500 is truly severe. One other thing we look at is monocytes. This is a cell that kind of gets overlooked a lot, but these are the cells that become the macrophages. So when they leave the bloodstream, they are one of the most important immune cells for really engulfing and digesting foreign pathogens. And when you look at a CBC, if you see a monocyte count less than 200, usually this is indicative of someone who's really not going to recover their count soon. So they have really prolonged and delayed recovery, and they're at super, super high risk of getting neutropenic fever. When you look at the patient that comes in the ER, we're concerned about them. If they're neutropenic and they're not febrile, these patients need to leave the ER right away because they're at such high risk of actually picking up something from the emergency room. If they are febrile and they're neutropenic, these patients get pan cultured. So that's blood cultures from both arms. They get blood cultures drawn off any indwelling lines. And then they also get chest x-rays, urinalysis, looking for any sort of occult pneumonia or any urine infection. One important thing on physical exam for these patients, we do not do a rectal exam or a core temperature because the thought is that that is a risk of introducing any sort of infection into these patients. These patients also get a very specific antibiotic regimen, so they all get cefepime. This is a little different than our go-to ceftriaxone. It's a little bit broader coverage and covers for Pseudomonas. It doesn't have any MRSA coverage. So if you're concerned that they have any sort of soft tissue skin infection or MRSA infection or any of their indwelling lines are infected, you have to add vancomycin. And then all these patients obviously get admitted, and they get admitted with neutropenic precautions. So that's a gown, gloves, and mask anytime anyone comes in the room. And they should be in a positive pressure room to reduce the risk of infection from other patients. That's all for today, guys. Have a great day.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.